Welcome to the Rotary Times Show, a public service program presented by Rotary District 7610, Virginia. Funding for this program is made possible by the generosity of Rotary 7610. On our programs, we talk with Rotarians and community leaders and discuss how Rotary International and how at each level helps the local, national, and world communities. I am your host, Rotarian Dr. Deborah Jackson from the Rotary Club of McLean, Virginia. Today, we want to learn more about where we are in this nationwide crisis around COVID-19, a virus which has impacted this nation on many levels, from the White House, as you heard recently this weekend, to communities locally, nationally, and worldwide. Our guest for this program is Dr. Chapy Venkatesan, and I'm going to ask him to restate that for me. And then I know he's affectionately known as Dr. Chapy, and if he doesn't mind, I'm going to call him Dr. Chapy.
Sounds great.
But in the meantime, I want my audience to know the pronunciation of your name.
Yeah, my name is Chapy Venkatesan.
There you go. Thank you for that.
Thank you for having me.
He's an internal medicine physician at Fairfax INOVA Hospital. So welcome, Dr. Chapy.
Thank you again for having me. It's an honor, Deborah.
It's our pleasure. I like taking every opportunity these days to educate our audience on the crisis that has truly upended how we navigate our daily lives. And this is something that still has a lot of unknowns and uncertainties around them. And I just always like it if I can spread the good news, because I want to say good news because we know what the bad news looks like, but I want people also to remain hopeful. So I'm glad you're here today to help us with that.
Wonderful. Thank you again.
Okay. But before we do that and get into the harsh realities of COVID-19, tell us about Dr. Chapy. Who is Dr. Chapy?
Sure. So again, my name is Chapy Venkatesan. I am an internal medicine physician. I trained at Georgetown for my residency and went to Eastern Virginia Medical School, which is in Hampton Roads, and that's where I grew up. So I grew up in the Hampton Roads area and currently live in Loudoun County, and I'm married, have 2 children. And while I was in residency, I spent a lot of my time at Fairfax Hospital, and loved it, loved the pace, loved the environment. And I started in 2004 as a physician there employed by INOVA, and have been with INOVA since 2004, and most recently was appointed to be the Chief Quality and Safety Officer for our health system. And in that role have been leading with a bunch of other great people our response to COVID-19.
Absolutely. And having heard you say that, I just want to even step back even further. And on behalf of Rotary, say thank you, because I know you were busy today, but you took the time to come be with us today, along with your colleagues who have really been doing an amazing job in this area, in this region of the state. So let me publicly say thank you, to you and your colleagues and everyone else who are out there on the front lines dealing with this issue.
Yeah, thank you so much. And again, thanks for having me.
Yeah. So talk to my audience about why it matters. Why does COVID-19 even matter?
Yeah, I think that's a great open-ended question, and I think that the reason why we should care and why it matters is, obviously you've heard in the news at this point that COVID-19 is a really deadly disease. It's a deadly disease that can impact any of us. And on top of that, COVID-19, if not lethal, can lead to some pretty long-term complications as well. And we should care as a community because of the impact of COVID, but also there are things that we can do as a community to help protect one another. And I think that's really why we should care.
Yeah, and I understand it's very highly contagious. Why does it spread so quickly?
Yeah, it's interesting. We're learning more and more every day about how COVID-19 spreads. And I think there are some important things for the audience to know that I'd want to emphasize. I think number one is that We know that COVID-19 spreads from person to person, and that's a very, very important point. Second, COVID-19 can spread from one person to another before someone is actually symptomatic, before they actually have symptoms. So that's very, very important as well. The primary ways that COVID-19 spreads from person to person is usually through close contact, through things that are called droplets that emanate from someone who is infected while they're either talking, coughing, or sneezing, and that would land really in the other person's nose or mouth and acquire the infection.
Gotcha.
Less likely would be other instances where droplets land on a surface and that surface is not clean and transmits it to the next person. There's actually hot off the press, very recent information as of a few hours ago, indicating that actually there can be some risk of what's called airborne transmission, which means that these droplets would stay suspended in the air a little bit longer than just falling to the ground. And the reason why that's important is because we know that that type of transmission is much more likely to occur in small enclosed places without adequate ventilation.
Wow, wow. Well, we heard it here, hot off the press, so small unventilated. So there are filters that I understand people can even put on their homes, or many businesses, I know doctors' offices are using, they have HEPA filters, I think that's what they're called. Are those recommended? I mean, do they work? What's your thinking on something like that?
There are a lot of great specifications through a couple great resources. The CDC, number one. The second is the Department of Labor and Industry guidelines through our state in Virginia. So a lot of very technical information about the best filters that work for each circumstance. But honestly, Deborah, I really do feel that a lot of it boils down to common practices that we all need to really follow if we are going to come together as a community to help protect one another. And those are really, I think, key fundamentals that I'm sure we'll talk about at some point.
And I hear the term asymptomatic and pre-symptomatic. Help my audience understand what that means, and is one more or less contagious than the other?
Yeah, absolutely. So I myself get a little bit sometimes without reading very, very closely between asymptomatic and pre-symptomatic. Asymptomatic means that someone has actually acquired the infection, but throughout the entire course never developed any symptoms. Pre-symptomatic is a phase of illness that occurs before someone actually develops symptoms. Now, if you have somebody who has COVID and does not have symptoms, there is no real way to differentiate which one of those will go on to have symptoms versus which one would actually stay without symptoms. And that's been a big part of the challenge with COVID is understanding that those without symptoms can in fact be spreaders of the virus. It is thought that those in that pre-symptomatic phase, so about 2 days before developing symptoms, is really where the highest amount of contagiousness is. And that's why, again, going to those fundamental precautions, which really involve some key things, including mask wearing in public places, hand washing with soap and water, and if soap and water is not available, to use hand sanitizer that's at least 60% alcohol. Cleaning and disinfecting surfaces, and then maintaining distance, 6 feet. Those measures are really shown to be very, very effective in mitigating transmission of COVID.
I was in a store the other day, and a young lady was purchasing the hand sanitizer for her purse. And I said to her, I would look on the back of that bottle first. And she looked at me like, what are you saying? And I said, to see what the alcohol content, I said, I think you would want to be beyond 60. And I wasn't sure, but now I know I was correct, when I said that to her. So she flipped it over, And she herself said, I think she said it was 60 something. I said, well, then you're probably okay. Because I said, mine had 92. So I guess I got the good stuff.
There you go. There you go. But, yeah, absolutely. At least 60%.
But that's important to know, because everyone is selling this stuff. But you know, I said you're paying for something that it may be not serving the purpose that you hope for. So
that's right.
Check it out on the back.
That's
you know?
right. That's right.
And so, well, that's good to know. When they talk about antibody testing, what does that mean?
Yeah, so COVID testing itself is big topic. Again, major attention in the press for very good reasons. In public health, testing is a key component of actually being able to identify individuals who might be contacts of those who actually had the disease, to be able to isolate and quarantine appropriately. But to your question specifically about antibodies, antibodies are a type of test. They're generated by our bodies and released in our blood. So it can be checked by a blood test to different infections that we might actually end up developing after being exposed. So a COVID-19 antibody test should be able to tell us whether we have been exposed to COVID-19.
Gotcha.
The difference in the uncertainty that we have right now compared to other antibodies for other viruses is that we don't know whether having an antibody means that you're actually immune from developing the disease again. So until we figure out the relationship between exposure and immunity, I believe the benefit of antibody testing is going to be a little bit limited.
I got you. And when you say quarantine, what does that mean?
Yeah, so two different things. And again, just like symptomatic and pre-symptomatic, there's quarantine and isolation. Okay. So quarantine really means separating yourself from others after you might have been exposed to somebody who had COVID. Isolation is the individual with COVID separating themselves from others. So quarantine and isolation, and that's really a very key component of a public health strategy to help decrease spread after someone may have been exposed to COVID but doesn't have symptoms.
So what's the typical length of someone that has to be quarantined as opposed to isolation? Or does that matter?
No, it does matter. We're still going with 14 days. That's the CDC recommendation.
So the CDC offers all the guidelines. We just need to pull them up and pay attention to them.
Absolutely, and I think that there's a lot of great material on there, and in concert with your physician, of course. I think together, lots of great information.
Well, I want you to hold that thought, because we're going to dig a little deeper here in a few minutes. We're going to take a short break and be right back and talk more with Dr. Chapy, an internal medicine doctor at INOVA Fairfax Hospital. Please stay with us. We'll be right back.
We are this close.
We're this close.
We are this close of wanting to
Making history.
This close to changing the world.
We are this close.
This close. This close to making sure no child suffers a crippling disease
ever again.
this close.
We are this close to ending polio.
Ending polio.
All we need is you.
This close.
If we don't act now, we may lose this chance forever. Help Rotary make history at endpolionow.org.
Welcome back to the Rotary Times. We're here with Dr. Chapy, an internal medicine doctor at INOVA Fairfax Hospital. We're talking about COVID-19 and INOVA's response to the community. Dr. Chapy, I have another question I've been wondering about, because I've been hearing a lot about it in the media and seeing some of the research on it myself. COVID-19 has had a huge impact on communities of color. Talk to us about that. Why is there this difference?
Yeah, you know, I think that's still, so that's definitely true. In Fairfax County, for example, I believe around 15 to 16% of inhabitants of Fairfax County are in the Latinx community. But over 50% of those with COVID are Latinx.
Wow.
So certainly, COVID-19 has certainly exposed and uncovered a lot of systematic differences, I think, that we have in our communities at large and with our nation regarding healthcare disparities.
Gotcha.
So there hasn't been an exact single answer to be able to explain why such a disproportionate acquisition of disease exists. It's not thought to be a genetic thing at this point. It's thought to be more related to other socioeconomic factors. So for example, those who are unable to telework are more likely going to be in work situations that may be in close quarters. Living situation itself, an inability to quarantine or isolate from a practical perspective are two really very big issues, and I think just some of the reason why we may see that disproportionate impact. At INOVA, what we really made it a point to do is to ensure that our resources online and our educational materials are translated into the top 8 languages that are non-English in our communities, because we strive to really meet the needs of the entire community. In addition, after Medicaid expansion, we did establish 4 separate clinics to help be able to serve the underinsured and Medicaid population called the INOVA Cares Clinics for Families. And through there, either through televisits or in-person visits, individuals can get assessed for COVID and tested if needed.
What's televisit? That's
So
a new term.
It would be a televisit where you would do it through your iPhone or your iPad, and you would have a provider on the other end to be able to talk verbally to you, and to be able, there's a lot of information that we can get verbally just with talking from a provider to a patient or a family. And so to be able to use these televisits are an effective way to really establish some connectivity, but at the same time decrease the risks that might be associated with the in-person visits. That being said, we really want to encourage during COVID that for urgent health needs or emergent health needs or even ongoing health needs, that really the healthcare setting at this point is an extremely safe environment. And so we don't want our community to feel that they should delay in hopes of decreasing their chances of COVID. We feel very confident about the safety for our patients when they come for in-person visits, and we very much encourage not to delay for health maintenance or for symptoms, because the sooner we can see someone, the sooner we can help.
Absolutely. That's a great message to kind of get out, that it is okay and it's safe, because that's another protection for you and your families and surrounding community members. What's the most effective treatment today? I mean, we've heard a lot, and especially in the last couple of days, I think I've heard so much about varying forms of treatment that one could receive. What's the most effective do we think of right now?
Yeah, it's a great question, and it should be a straightforward question, but I might complicate it a little bit. Okay. There is no FDA-approved treatment for COVID-19. So I think that's very important. And so the best way to protect one another and protect yourself is to avoid getting the virus altogether, which goes back to those fundamental issues and fundamental interventions that we talked about.
And what are
that
those
are relatively
again?
simple. So I would say 4 things, right, for all of us, right? Number 1, frequent hand washing with soap and water.
There's a time on that, I hear.
That's right.
But
that's
is it
right.
30 seconds?
That's right. Or 2 happy birthdays.
Or 2 happy birthdays. Okay.
So with soap and water, or with hand sanitizer, at least 60% alcohol. The second is cleaning and disinfecting of surfaces. The third, and these are all together. I'm saying the third, but they're not in any particular order. The third is distancing, 6 feet. And the fourth is wearing masks in public when you're around folks that are not a part of your household.
Gotcha.
So avoiding getting the virus in the first place is really the most effective. That being said, there are some promising treatments that are in the pipeline and already out there in use. The challenge is, Deborah, that the reason why there isn't FDA approval yet is because the data is emerging. So FDA issues what's called an EUA, an emergency use authorization, because we're in a crisis. Sometimes we can't wait for the full papers to come out or to follow up for this amount of time. They will say between the provider and the patient, using these criteria, one should consider using these different medications. But I want to emphasize again, there is no FDA approved treatment at this time, and therefore prevention is going to be the best treatment.
Gotcha. And we're going into the fall, so that's going to be a challenge in itself. Many here are saying we need to get the flu shots, pneumonia shots. Would you recommend those as well?
Absolutely. You know, I think for multiple reasons. Number one, the flu shot, and the reason why we get the flu shot is for influenza, seasonal influenza. And it's interesting, what has been noted in the southern hemisphere because of the public health measures they put into place, the influenza season thus far has been very light. So a lot of the clinical symptoms of COVID and clinical symptoms of influenza are very, very similar. Okay. COVID seems to transmit much more efficiently, so it's more contagious than influenza. But it tends to be the same things that help prevent the spread. Those four things that we talked about, right?
So those four things.
But influenza vaccination, very, very important, I think, for a few reasons. One is it's always important, even not during a COVID pandemic. On top of that, being able to be vaccinated and decreasing the burden of disease as individuals and in the community takes us back to the conversation we were having in the April-May timeframe, which was flattening the curve, right? We don't want our healthcare systems to be overwhelmed by not only COVID, but influenza, because influenza in its own right is a very, very serious disease. So that would be the most important reason why I would say it's even more important than normal influenza seasons. In addition, the symptoms are very, very indistinguishable, except for a couple things. It seems to be that COVID-19 is more likely to be associated with loss of taste and smell than influenza. So for those reasons, I'm really glad you brought that up. I think influenza vaccination is going to be really crucial because influenza, as influenza goes, may to a large extent determine how the winter goes for all of us.
Wow. Something to really think about. I've been encouraging family and friends to make sure they get their shots this year.
Excellent.
The million-dollar question, what's the most promising vaccine in development right now?
Yeah, vaccines, obviously, that's a huge topic of conversation and something that we're all hoping for and waiting for, right, is vaccination. I'll probably focus a little bit more on the generalities about vaccines and the COVID-19 vaccine. At this time, there do seem to be some promising candidates. It's interesting because there are some logistical issues associated with them in terms of storage, even simple things like storage. Some of the candidates need to be stored in super sub, I think it's like -80 degrees or something like that.
Wow.
But what I would say is that promising candidates coming down the line, vaccine will need to be part of our ultimate strategy to help eradicate COVID. It will likely be distributed in a priority manner, meaning those who are really at the front lines, right, and have a high risk of acquiring COVID. And soon after that, or in parallel with that, those who actually are very high risk for having something bad happen if they develop COVID. I think there's a lot more to come when it comes to vaccination and a lot of ethical dilemmas actually about ensuring that there's equitable access to the vaccines, which I know would be important to our Rotarians. So, but yeah, more to come on vaccines. Seems to be thus far that at least short term, very, very safe, but more to come.
There you go. Well, I want to thank you for the knowledge that you have brought today. I'm hoping that you will even come back again and update us. Whenever you find out something, it was nice to be able to say, we heard it here today.
There you go.
So I'm hoping that that'll be the same. In one sentence, can you just tell our viewing audience the thought that you just want to leave them with about COVID-19?
COVID-19 is extremely serious and must be taken seriously.
Yeah, I would agree with you on that one. Dr. Chapy, it's been my pleasure to have you here today.
Thank you so much.
We needed a whole nother hour, I think, to really make this happen. So I'm very appreciative of the time that you have given. So come back and see us.
Absolutely. No, I appreciate the invitation. Thank you.
Funding for this program is made possible by the generosity of Rotary District 7610. For the Rotary Times program, again, I'm your host, Rotarian Dr. Deborah Jackson from the Rotary Club of McLean, Virginia. You're welcome to join us at any Rotary Club in your area for either breakfast, lunch, or dinner. You can find a club nearest you by just logging in to us on the internet. Remember, our time is your time, and it's always time well spent. Please join us for our next program as we continue to celebrate Rotary's 115 years of service above self.